Morning, everybody. It's been a while since I've been on air. This morning is going to be slightly different from the normal run-of-the-mill plumbing. It is something that is very current and something that I've had the displeasure of actually experiencing. So let's get straight into this morning's presentation. When we're looking at Business 101, and we're looking at COVID, and I can imagine 80% of the attendees rolling their eyes backwards and falling out of their chairs and taking their cup of coffee and walking away. But guys, this is something that happened, or this is something that I've had to experience and I'd like to share with you. I have learned while dealing with the training guys, there is a term called SME, which is a subject matter expert, which I'm not. I'm not a doctor. I'm not a medical professional. I am a plumber, and I'd just like to make a point around what is happening at the moment. I don't have to tell you what Corona is. I just like to highlight a couple of things that when older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. Sorry, just need to get my hand out here. I'd like to point out to you that according to our health department and the World Health Organization, about 6 to 9% of our population suffer from diabetes. According to South African stats, 17% of deaths in South Africa is heart related. When it comes to high blood pressure, hypertension, 26% of females and 27% of males suffer from hypertension or high blood pressure for us normal human beings. And then when it comes to respiratory disease, the numbers are staggering, but they're also confusing. So let me just add, or let me put in there that people with TB and HIV and asthma, if you take the numbers around all of those people that could possibly have respiratory issues, the numbers are staggering. So if you take the normal underlying or what they comorbidities that refer to, you can see in total it actually affects quite a number of people. I happen to be in that category, just for interest sake. So when we look at the introduction for this morning session, life before the 26th of October for me, and by the way, this is not my CV. I'm not looking for a job. Just looking at what I do as a rule of thumb, and then in brackets behind each of those lines, you'll see the frequency of contact or the amount of contact that I had with other people. So as far as the IOPSA is concerned, I'm the current president. So occasional contact with other human beings, mostly electronic. Regional Eastern Cape chairman, WhatsApps, electronic, occasional meeting with limited numbers with the exco, not the actual members. We don't have live actual meetings yet. And as a compliance auditor, before the 26th of October, we did by appointment with safety protocols. And I'm sure you've heard the bits and pieces before around the audits, that you need to make sure that no one in the home's got. You've got to put in a declaration to say that you clean. You've got to sanitize in front of the house that you walk into, and all these different types of things. So when we're looking at safety protocols in place for those audits, and then as far as the Nelson Mandela Bay municipality, my current employer, I am the Senior Plumbing and Drainage Inspector responsible for plan scrutiny up to the completion of building. And as far as my workplace was concerned, the staff that work on that floor were all on rotational roster, limited contact with each other, the 50% that was on and the 50% relieving them or rotating onto the next day. They didn't even have contact with each other, and individuals obviously from outside the office. We do inquiries from architectural and engineering professionals. We had occasional meetings, very occasional, because very few people actually walked into our buildings. And it was also mostly electronic at home. So the last bit, on a personal note, very limited contact with people outside of work, not because I'm a hermit, or what do you call those little people that hide away, but because, you know what, when you consider yourself a law-abiding citizen, you play by the rules. Shopping was only done out of necessity, and I was very particular when it came to sanitizing regularly. Like as I said to Karim earlier, when you start from your hands and you go up to the sleeves of your shirt to make sure that whatever sticks out is clean, and the wearing of quality masks. Now, before I carry on here, life carries on as I'm speaking to you now, pretty much as that slide shows you there. The only difference is that on the 26th of October, I was rushed into ICU. I passed out at home, and I ended up getting taken to hospital following a couple of miracles. Firstly, there was no ambulance, so a lady that sat 920 kilometers away from us in Kuruman made a phone call, and 15 minutes later there was an ambulance that picked me up and dropped me off at the first hospital. There were no beds. I ended up on that hospital, or on that ambulance, at Gurney, and I was left in a storeroom because the senior sister refused to let me go out the door. And I was lying amongst the gas bottles and the fridges and that, and I passed out again, lost consciousness, and I woke up in a different hospital in an ICU room. Now, that was the only ICU room available in the metro between 5 hospitals. I ended up in that one there. And I was helped by some very special, dedicated people. I ended up waking up with 4 drips, and after 3 days I was told that they have sufficiently stabilized me and I can go back home to recover. So the point is that, yes, all of the things you see on this list, I'm back to doing majority of that. The reason I'm listing this is, you in the room as business owners, all you need to do is tick one of those boxes. If you're meeting with clients and you do occasionally go out to shop, or you do you come into contact with your staff in the building, even if it's limited contact, even if it's rotational, if you ticked any of these boxes that are on that list, then you have got as good a chance as the next guy to actually contract this disease. I'm not a doom prophet, make no mistake. I'm generally a very positive guy, so don't get me wrong. Just a quick look at our businesses, or our industry for that matter. COVID started on the 27th of March 2020, and we are currently in stage 1 with rumors of that changing, or the change to that, very imminent. I'd like to remind the plumbers in the room and the plumbing company owners in the room that as far as work, maintenance work, and loss of income, plumbers were lucky, if you're going to call it that, to be included in essential services. There we listed under point number 33 as a trade necessary for the rendering of emergency repair work. So we were able to actually run our companies, not like we used to, but we were able to operate, and the guys that were in construction had to do a bit of maintenance to keep afloat, but there was always movement. And when you look at these essentials, or being listed as an essential service, I think it's only fair that we mention both IOPSA and PIRB. Right from the word go, when this thing struck and it was locked down, between IOPSA and PIRB, the leadership and the management in place at the time, we had regular updates on the status of various levels. They were assisting plumbers with application forms to apply for essential services. We had the CIPC forms. We had advice on protocols going out on Facebook, our website, all over the place. The list is a mile long, including going as far as to assisting with additional webinars to allow the guys to catch up on their CPD points in the safety of their home and offices. So you can see, as far as the plumbing industry is concerned, we've always tried to work towards progressing, but having that safety at the back of our minds. Now we get to the current situation where we find ourselves, and this is the reason why you have a non-subject matter expert discussing COVID with you. As a plumber and as a very proud survivor of this horrible disease, I need for you to look at the 24th of November up to, well, this is Tuesday, sorry, from Tuesday to Saturday. You'll see that there were 356 deaths and almost 13,000 more infections, more positive cases identified. 13,000 in 4 days. And you can look at this as a national stat. This is actually from our health department. So this is not from a fake website. This is the one that you can actually Google and they'll give you the stats. But I'm not sure how many of you are in which region. So I'm going to go slow. I'm going to leave it for 2 seconds. Find your province and have a look at the total cases for 26 November 2020. And then, as I spoke to Steve this morning, you can see as of today, the cumulative total is that with 3,069. So it's more than 3,000 new cases. So once you found your province, I'm in that one. So you can see it gives account of just all of the provinces in there. You look at the number and then I move on to the next slide and you see that in our case, there was a considerable jump on that. And once you found your province on the 27th of November, that's where you stood with 3,370 new cases being identified. And then on the 28th, which is where these stats end, you'll see there's another 3,200 new cases. So having looked at your province and looking at the numbers, I can tell you that unfortunately, as things stand now, the Eastern Cape in 3 days from the 26th to the 28th, there were just short of 2,900 new cases in 3 days. And you can go back and compare that to the numbers that we had in the first wave or the first occurrence of what happened there. So these things are on the internet. You can Google them. It's just an indication of where we are at the moment. The guys are becoming lax, or not the guys, the population or the country. And because we're in stage 1, we can do what we want to, and this thing is no longer there. And you still get people sending out WhatsApp videos and little quirks about this is a foofy and this is a joke. I can tell you, if you're lying on your back and you're fighting every breath and you're trying to get air into your lungs because you need that air, then you feel like putting that video clip where it doesn't belong in another person's body. So this being the background of where we are now and part of what happened to me. So let's look at when it comes to your business and COVID. June 2020, you'll see 2 months after the first, or 2 months after the lockdown started, there was a consolidated COVID-19 direction on health and safety in the workplace. So the fact that it was gazetted means that this year is law. It is not negotiable. It's not if you can afford it. It's not if you stay, or whether you stay in a metro or whether you stay in a little town like my sister. I think they've had 5 cases in total in the whole first wave. So unfortunately, the rules still apply to them, or it's probably because they applied the rules that they ended up only having 5 cases. But the point is that the Department of Employment and Labor issued guidelines for employers. This is why we're talking to you. We're talking Business 101. We're talking the employers of staff or people working for you to deal with COVID-19 in the workplace. Then I'm going to skip. You'll see it's all part of the same document. I've just taken out the most important bits. The Occupational Health and Safety Act reads that the regulations and incorporated standards require the employer to provide and maintain, as far as reasonably practicable, a working environment that is safe without risk to the health of workers, and to take such steps as may be reasonably practicable to eliminate or mitigate hazard or potential hazard. That has always been part of the health and safety. So for the guys that have looked at that, our country's law or our country's legislation, you'll find that the Occupational Health and Safety Act is right up there with a big hammer, so that if this thing falls down on you, it comes down from a dizzy height. Then the the follow-on says that the Health and Safety Act requires employers to ensure, as far as reasonably practicable, that all persons who may be directly affected by the activities, such as customers, clients, or contractors, and their workers, take note, and their workers, who enter their workplace or come into contact with the employees, are not exposed to hazards to their health or safety. And this applies to self-employed persons. Take note, for example, plumbers or electricians. So it cannot be more clear than that. It is actually part of the legislation that was gazetted. It includes, for example, plumbers or electricians, because you need to go to someone else's place. So whose working activity brings them into contact with members of the public. And then, just as a little finishing up of that specific page, this direction does not reduce existing obligations of the employer in terms of the health and safety, nor does it prevent you from putting measures more stringent in order to prevent the spread of virus. If your company policy says you will wear 2 masks, then that's what the document also says, that any staff working for you shall comply with these requirements that are in place. If it's not practicable to arrange workstations to be spaced at, so skip the plumber, we don't have workstations, we don't have fixed working places, we can't have barriers in our vehicles between, you go to site in a bakkie, you've got people in there. We skip straight to the point when it says, when required, the employer must, when required, supply the employee free of charge with the appropriate PPE based on a risk assessment of the workplace. So we all know we don't have an office, so your plumber needs to have his vehicle cleaned up. I even had to have my vehicle, which I don't work with, or I don't have staff getting into the vehicle. In the recovery period after I was left out of hospital, I was also instructed to sanitize or to fumigate my vehicle, because I was in that vehicle before going to hospital. So even the vehicles, the stuff that you touch, everything that they come into contact with, you'll see that this is a standard list of health and safety, or this comes from a screen where you need to do the distancing, you need to do the sanitizer, and each of these things that are required here are actually included in that legislation. This one is a bit of a no-brainer. Every employer must take measures to screen work when they report for work in order to ascertain if there are symptoms. And then you can actually have a look at the symptoms: fever, body aches, redness of eyes, nausea, vomiting, diarrhea, fatigue, weakness, or tiredness. I can tell you that up to today, I've never had a fever. This virus attacks you in different ways, or it affects people in different ways. So when we look at these things here, this is simply a list that you need to work your way through. And the same thing is that they require the workers to immediately inform the employer if they experience any of these symptoms. And while I go to the next screen, herein lies the problem that we do have. When a guy gets, or an employee gets booked off from work, he's either going to go on full pay, which he can consider himself very lucky, or he can go off at 40% or 50% or no pay. So please bear in mind, when you do have your people screened, or when your people come in and they screened, asking someone if he's got a cough. That person, dependent on his day's wages, or dependent, or his whole family is dependent on that income from your company, then if it was me, I would not cough while that thing was done. But it's not what I'm trying to get at. It is not something that you ask in the morning, do you cough? Do you have fever? It's something that you need to monitor. That guy, he's not going to maybe come up and be honest and say, yes, I do feel a bit nauseous or whatever, because he might get sent home and he might not get paid for the day. Or if the guy, if the company is serious, they go to isolate, he might lose a week or 10 days or whatever worth of wages. So the idea is to actually monitor them for the duration of their time at work, not simply a questionnaire in the morning. Anyway, so get back to, if a worker presents COVID-19 symptoms, the employer does not permit the worker to enter the workplace or report for work. I was unfortunate that at the time of getting sick, there were 6 of us on the floor, including the COVID officer taking the temperature and your cell phone number and ID number at the door. It's a case of who watches the watchman. Point is, it can happen all over. But if there are any symptoms, you do not permit that worker to enter your workplace. Not only for the balance of your staff, please, guys and girls, it's also about your family, your parents, your children, and your livelihood. If you get infected and you've got to be out of work for 2 weeks, it affects your company, it affects your operations, it does make an impact. If the worker is already at work, you need to isolate him, provide him with a mask, and make sure he gets transported back to his house or to a place of safety. And that is without getting your other staff being or putting your other staff at risk, transporting him away or transporting him out of the workplace. Then, and this is something that is a bit of a hassle at the moment, and then you assess the risk of transmission, disinfect the area and the workers' workstation, undertake contact tracing, and refer the workers that who may be at risk for screening, and take other measures. So whenever there's an exposure to a positive case, you'll find that the guys actually end up abandoning the office so that it can get fumigated or disinfected or sanitized before they can come back to work. Then, this is, like I said earlier, we're talking about a loss of income, we're talking about being affected. If a worker is being diagnosed with COVID-19, and according to the Department of Health, you may only allow a worker to return to work on the following conditions: 14 days of self-isolation, and if you're not sure, the worker has to undergo a medical evaluation confirming his fitness to work if the worker had moderate or severe illness. The employer ensures that the personal hygiene, I'm not going to mention that, that should be actually be done without it being stated here. The employer closely monitors the working for symptoms, and the worker wears a mask for 21 days. He's supposed to be wearing a mask every single day, all the time. For the purpose of these clauses, hand sanitizer, all know about those. I've got one in my Hilux, I've got one in the front door, I've actually got one of these mounted against the wall in my office, I've got one of these at the back door, because sometimes you can't have enough of this. I'm not saying you've got to do the same. I'm just saying that if you have a waterless one in the vehicle and you have one wherever you need to go, it is one way of ensuring that not only if you were in contact before you touch your face or your mouth, or get it into your lungs or into your mouth, is to actually clean up, and it is a definite way to make sure that you're not the person that actually transmits it to the next lot. Same thing applies to masks, and take note that every employer will provide these employees free of charge with a minimum of 2, which comply with the requirements as set out in the Department of Health's recommendations, and for the employee to wear while at work and while commuting to and from work, and require any workers to wear masks in the workplace. The only reason you have 2, or you're required to hand or to issue them with 2, is so while you're wearing the one, you can actually wash the other one, because you need to actually maintain those masks as well. While we're on that subject, or on the subject of lungs, I happened to pick that up on the Facebook page. I'm not actually a Facebook guy, but you can only watch so many cooking channels and crime channels before you start looking at other things to keep you busy. Something worth looking at, and it's something that you need to share with your staff, especially the guys that actually go onto site replacing geysers and working in older buildings. We're looking at not only the dust in ceilings, but we're also looking at mold in bathrooms. We're looking at the various types of things that could happen to your lungs. So there's a nice bit of reading on IOPSA's Facebook page. You can see the top 10 safety tips, protect your lungs. And it all boils down to wear the mask. It's a nuisance. It fogs up your glasses. You can have 10 reasons to not wear your glasses. You need the one to keep you safe. It cancels out all the others. And in almost closing, this is something, it's a screenshot from my phone, something I read on Business Tech. It's not official, please. This could be spam mail, but I do know that Dr. Mkhize was in PE, and a decision was taken as far as hotspots are concerned. And please don't be fooled into seeing on TV that the Eastern Cape is the hotspot. It is becoming a national occurrence. So the decision was basically taken that they were going to skip level 4 and take us straight back to level 3 lockdown. Various businesses and the rules and that being affected. I'm not going to elaborate on that. All as I'm saying is, guys, we're currently on level 1. We have got the freedom to move around. We have interprovincial travels and all kinds at our disposal, and we're not being curbed in as bad a way as if we had to go back to level 3. But as far as I'm concerned, and it's just my personal opinion, if level 3 we need level 3 to keep people from complying or to keep people from listening to the rules or abiding by the rules, then so be it. If the guys that need to buy something strong for the braai, or you need to buy something cold, then you do that before we get to level 3. But then if you didn't, level 3 is more important in saving lives and having access to a bottle store or cigarettes or whatever you feel your sins are or your requirements are. It is going to happen, guys. We have become lax. Our companies, our operations, the way we operate, you see how many people walk around without masks, and you see people walking past that sanitizer when they walk into the shops. They could have just touched something outside and leave it on a shelf somewhere or whatever. It's not about becoming paranoid. It's around getting safety and cleanliness and just taking care of this. If you forget every single thing I said this morning, and I'm hoping not, your employees are your responsibility. Look after them so that they, and you for that matter, can return home to your families safely every single day. I went into hospital, into ICU with 4 friends, golf partner for 15 years, elderly from church just up the street. Out of the 5 that went into ICU, I am the only one that came home. Our elderly from church was here at the door about 2 or 3 days before he went in, or before we went in. And the first thing that crosses your mind is, you know what? I could have given that old man that virus. We did sanitize, or there is a couple of bottles of sanitizers at the front door, but it is something that haunts you. It is something that sticks with you. You do not want to go home from work. And for those of the fortunate enough to have their parents with them and still have their kids at home, you do not want to be that person that takes this virus into your environment. So please look after your employees and yourself, and make sure that you can return home safely every day, and make sure that you look after your family and your kids. This thing is not a joke. And yeah, like I said to you, if you doubt, Google some of these videos. I can, for those that know me and those that are on groups, I don't want to send these things out all over the place, but there are videos showing bodies being stacked in plastic bags in hospital passages because there's not enough room for the people dying. Okay, that's my little bit for this morning.